Okay, I think you all know that what chamomile is. You're all used to that, right? So, pretty picture from WebMD, and the rest of the garbage is, I would take it a grain of salt. And then there's a lot of health benefits from it. You can see that, right? So let's just read this one through real quick. Use our handy computer lady.
Chamomile. Chamomile benefits. The word chamomile actually refers to a range of different daisy-like plants which are a member of the Asteraceae family. There are many different species of chamomile, the two most commonly being German chamomile, Marticaria recutita, and Roman chamomile, Chamaemelum nobile. They have been used since ancient times for their calming and anti-inflammatory properties, and each offer their own additional health benefits. History. Chamomile is an age-old medicinal herb known in ancient Egypt, Greece and Rome. Chamomile's popularity grew throughout the Middle Ages when people turned to it as a remedy for numerous medical complaints including asthma, colic, fevers, inflammations, nausea, nervous complaints, children's ailments, skin diseases and cancer. As a popular remedy, it may be thought of as the European counterpart of the Chinese tonic ginseng. Habitat. Chamomile are native in many countries throughout Europe, and are cultivated in such countries as Germany, Egypt, France, Spain, Italy, Morocco, and parts of Eastern Europe. The various different chamomile plants are very distinct and require their own set of conditions to grow. For example, Roman chamomile is a perennial plant, meaning it will live more than 2 years. It grows close to the ground and has smallish blossoming flowers. It tends to be bitter when used in teas. German chamomile, on the other hand, is a sweeter variety. It is an annual plant and can grow large blossoms up to 3 feet in height. Active ingredients. The plant's healing properties come from its daisy-like flowers, which contain volatile oils, including bisabolol oxides A and B, and matricin, as well as flavonoids, particularly a compound called apigenin, and other therapeutic substances. Health benefits. Chamomile has been used for centuries in teas as a mild, relaxing sleep aid, treatment for fevers, colds, stomach ailments, and is an anti-inflammatory, to name only a few therapeutic uses. Chamomile may be used internally or externally. Extensive scientific research over the past 20 years has confirmed many of the traditional uses for the plant and established pharmacological mechanisms for the plant's therapeutic activity, including antipeptic, antispasmodic, antipyretic, antifungal, and anti-allergenic activity. Recent and ongoing research has identified chamomile-specific anti-inflammatory, antibacterial, muscle relaxant, antispasmodic, anti-allergenic and sedative properties, validating its long-held reputation. This attention appears to have increased the popularity of the herb, and nowadays chamomile is included as a drug in the pharmacopoeia of 26 countries. Specifically, chamomile may 1. As a tea, be used for lumbago, rheumatic problems and rashes. 2. As a salve, be used for hemorrhoids and wounds. 3. As a vapor, be used to alleviate cold symptoms or asthma. 4. Relieve restlessness, teething problems, and colic in children. 5. Relieve allergies much as an antihistamine would. 6. Aid in digestion when taken as a tea after meals. 7. Relieve morning sickness during pregnancy. 8. Speed healing of skin ulcers, wounds, or burns. 9. Treat gastritis and ulcerative colitis. 10. Reduce inflammation and facilitate bowel movement without acting directly as a purgative. 11. Be used as a wash or compress for skin problems and inflammations, including inflammations of mucous tissue. 12. Promote general relaxation and relieve stress. Animal studies show that chamomile contains substances that act on the same parts of the brain and nervous system as anti-anxiety drugs. Never stop taking prescription medications, however, without consulting your doctor. 1. Control insomnia. Chamomile's mildly sedating and muscle relaxing effects may help those who suffer from insomnia to fall asleep more easily. 2. Treat diverticular disease, irritable bowel problems and various gastrointestinal complaints. Chamomile's reported anti-inflammatory and antispasmodic actions relax the smooth muscles lining the stomach and intestine. The herb may therefore help to relieve nausea, heartburn, and stress-related flatulence. It may also be useful in the treatment of diverticular disorders and inflammatory bowel conditions such as Crohn's disease. 3. Soothes skin rashes, including eczema, minor burns and sunburn. Used as a lotion or added in oil form to a cool bath, chamomile may ease the itching of eczema and other rashes and reduces skin inflammation. It may also speed healing and prevent bacterial infection. 4. Treat eye inflammation and infection. Cooled chamomile tea can be used in a compress to help soothe tired, irritated eyes, and it may even help treat conjunctivitis. 5. Heal mouth sores and prevent gum disease. A chamomile mouthwash may help soothe mouth inflammations and keep gums healthy. 6. Reduce menstrual cramps. Chamomile's believed ability to relax the smooth muscles of the uterus helps ease the discomfort of menstrual cramping. Chamomile essential oil. Chamomile oil is an essential oil extracted from the chamomile flower. Chamomile essential oil is extracted from the blossom flowers of the plant. To extract oil from the plants, most manufacturers use steam distillation. The flowers are placed in a still, where hot steam is then applied. The steam, which must be hot enough to penetrate the plant without burning it, forces the essential oil out of the plant so it can be collected independently. The amount of oil each plant yields depends on the variety. Fresh Roman chamomile flowers tend to yield 1.7% essential oil, while German chamomile flowers yield only 0.2 to 0.4% essential oil. Relaxation. The oil serves many medicinal purposes, but one of the best documented uses is for relaxation. The oil has a calming effect on people, and can be used to help induce sleep, ease frayed nerves, and promote a general sense of calmness and well-being. It is great for those with nervousness or anxiety problems. Aside from having mental calming properties, chamomile is also good at relaxing sore muscles and tight joints. It can ease menstrual cramps and backaches, as well as relax the digestive system to ease upset stomach or indigestion issues. When applied topically to the skin, it soothes redness and irritation. For this reason, it is a common ingredient in skincare. It also eliminates itchiness and is good for those with allergic reactions. Sometimes chamomile is used on rashes. Because of its anti-inflammatory properties, it can work to take down swelling caused by rashes or skin irritants. Finally, the oil has antibacterial properties and can help to clean and protect wounds from infections. It is commonly used as an all-natural remedy for dental abscesses, conjunctivitis, and other infections. Consumption. There are a wide variety of ways in which chamomile essential oil can be ingested or applied on the body, depending on the reason the product is being used. For example, the oil can either be applied topically, when dealing with skin problems, or ingested orally, for upset stomach or other gastrointestinal issues. To ingest the oil, it should be diluted into water, as only a small amount is highly potent. 1 to 2 drops in a glass of water should be sufficient for using as a mouthwash or ingesting for stomach problems. To use in a bath as an aromatherapy agent and muscle relaxant, less than 10 drops should still be sufficient. The scent of the essential oil can be inhaled as a form of aromatherapy. The oil can be vaporized for aromatherapy use. This method works well to soothe nerves and headaches. It can be blended with another oil, such as sesame, mineral, or olive, to be used for massaging aching muscles and joints. Finally, the oil can be blended with other cream-based lotions to provide relief from rashes and irritated skin. Other uses. In addition to medicinal use, chamomile enjoys wide usage, especially in Europe and the US, as a refreshing beverage tea and as an ingredient in numerous cosmetic and external preparations. Rob McCaleb, president of the Herb Research Foundation in Boulder, Colorado, estimates that over 1 million cups of chamomile tea are ingested worldwide each day, making it probably the most widely consumed herbal tea. Cautions. While chamomile essential oil is generally quite safely used by people of all ages, it is not recommended for those who are pregnant. Additionally, it is recommended that those with strong allergies to plants such as ragweed do a spot check on a small patch of skin before applying to the whole body. This is because chamomile can, on occasion, cause allergic reactions. If you suffer from allergies to plants of the Compositae family, a large group including such flowers as daisies, ragweed, asters and chrysanthemums, you may wish to be cautious about using chamomile at first. While there have been isolated reports of allergic reactions causing skin rashes and bronchial constriction, most people can use this herb with no problem. Always take care when taking herbs and read our disclaimer. How to take herbs. Herbs can be taken internally or used externally in various ways. Knowing how to use or prepare herbs and what dosage to take is vital to ensure safe and effective use. Where to buy.
Okay, so let's go to the benefits of chamomile tea. Reducing menstrual pain, treating diabetes and lowering blood sugar, slowing and preventing osteoporosis, reducing inflammation, cancer treatment and prevention, helping with sleep and relaxation, and treating cold symptoms and treatment for mild skin conditions. And then let's look at this thing from the National Health Institute, which actually is going to give you a pretty good rating on this. So we'll let the computer do its thing again, and we'll go through this.
Chamomile, a herbal medicine of the past with bright future. Abstract. Chamomile is one of the most ancient medicinal herbs known to mankind. It is a member of Asteraceae Compositae family and represented by two common varieties viz. German chamomile Chamaemelum recutita and Roman chamomile Chamaemelum nobile. The dried flowers of chamomile contain many terpenoids and flavonoids contributing to its medicinal properties. Chamomile preparations are commonly used for many human ailments such as hay fever, inflammation, muscle spasms, menstrual disorders, insomnia, ulcers, wounds, gastrointestinal disorders, rheumatic pain, and hemorrhoids. Essential oils of chamomile are used extensively in cosmetics and aromatherapy. Many different preparations of chamomile have been developed, the most popular of which is in the form of herbal tea consumed more than 1 million cups per day. In this review we describe the use of chamomile in traditional medicine with regard to evaluating its curative and preventive properties. Highlight recent findings for its development as a therapeutic agent promoting human health. 1. Introduction. The interplay of plants and human health has been documented for thousands of years. 1 to 3. Herbs have been integral to both traditional and non-traditional forms of medicine dating back at least 5,000 years. 2, 4 to 6. The enduring popularity of herbal medicines may be explained by the tendency of herbs to work slowly, usually with minimal toxic side effects. One of the most common herbs used for medicinal purposes is chamomile, whose standardized tea and herbal extracts are prepared from dried flowers of Marticaria species. Chamomile is one of the oldest, most widely used and well-documented medicinal plants in the world and has been recommended for a variety of healing applications. 7. Chamomile is a native of the Old World and is a member of the daisy family, Asteraceae or Compositae. The hollow, bright gold cones of the flowers are packed with disc or tubular florets and are ringed with about 15 white ray or ligulate florets. Widely represented by two known varieties viz. German chamomile, Marticaria chamomilla, and Roman chamomile, Chamaemelum nobile. 8. In this review we will discuss the use and possible merits of chamomile, examining its historical use and recent scientific and clinical evaluations of its potential use in the management of various human ailments. 2. Active constituents of chamomile. Different classes of bioactive constituents are present in chamomile, which have been isolated and used as medicinal preparations and cosmetics. 9. The plant contains 0.24% to 1.9% volatile oil composed of a variety of separate oils. When exposed to steam distillation, the oil ranges in color from brilliant blue to deep green when fresh but turns to dark yellow after storage. Despite fading, the oil does not lose its potency. Approximately 120 secondary metabolites have been identified in chamomile, including 28 terpenoids and 36 flavonoids 10, 11. The principal components of the essential oil extracted from the German chamomile flowers are the terpenoids alpha-bisabolol and its oxide azulenes, including chemazoline and acetylene derivatives. Chemazoline and bisabolol are very unstable and are best preserved in an alcoholic tincture. The essential oil of Roman chamomile contains less chemazoline and is mainly constituted from esters of angelic acid and tiglich acid. It also contains farnesene and alpha-pinene. Roman chamomile contains up to 0.6% of sesquiterpene lactones of the germicranolide type, mainly nobilin and 3-epinobilin. Both alpha-bisabolol, bisabolol oxides and B and chemazoline or azoline est, farnesene and spiroetherquiterpene lactones, glycosides, hydroxycoumarins, flavonoids, apigenin, lutein, pitulitin, and quercetin, coumarins, and mucilage are considered to be the major bioactive ingredients. 12-13. Other major constituents of the flowers include several phenolic compounds, primarily the flavonoids apigenin, quercetin, pitulitin as glucosides and various acetylated derivatives. Among flavonoids, apigenin is the most promising compound. It is present in very small quantities as free apigenin, but predominantly exists in the form of various glycosides. 14-18. 3. Healthcare preparation of chamomile. Chamomile is known to be used in various forms of its preparations. Dry powder of chamomile flower is recommended and used by many people for traditionally established health problems. Medicinal ingredients are normally extracted from the dry flowers of chamomile by using water, ethanol or methanol as solvents, and corresponding extracts are known as aqueous, ethanolic, alcoholic, and or methanolic extracts. Optimum chamomile extracts contain about 50% alcohol. Normally standardized extracts contain 1.2% of apigenin, which is one of the most effective bioactive agents. Aqueous extracts, such as in the form of tea, contain quite low concentrations of free apigenin but include high levels of apigenin 7-O-glucoside. Oral infusion of chamomile is recommended by the German Commission E. 19. 20. Chamomile tea is one of the world's most popular herbal teas, and about 1 million cups are consumed every day. Tea bags of chamomile are also available in the market, containing chamomile flower powder, either pure or blended with other popular medicinal herbs. Chamomile tincture may also be prepared as 1 part chamomile flower and 4 parts of water having 12% grain alcohol, which is used to correct summer diarrhea in children and also used with purgatives to prevent cramping. Chamomile flowers are extensively used alone, are combined with crushed poppy heads, as a poultice or hot foment for inflammatory pain or congestive neuralgia, and in cases of external swelling, such as facial swelling associated with underlying infection or abscess. Chamomile whole plant is used for making herb beers, and also for a lotion, for external application in toothache, earache, neuralgia and in cases of external swelling. 20. It is also known to be used as bath additive, recommended for soothing oniogenital inflammation. 21. The tea infusion is used as a wash or gargle for inflammation of the mucous membranes of the mouth and throat. 22-23. Inhalation of the vaporized essential oils derived from chamomile flowers is recommended to relieve anxiety, general depression. Chamomile oil is a popular ingredient of aromatherapy in hair care. 24-25. Roman chamomile is widely used in cosmetic preparations and in soothing and softening effect on the skin. 26-27. 4. Traditional use of chamomile. Traditionally, chamomile has been used for centuries as an anti-inflammatory, antioxidant, mild astringent and healing medicine. 28. As a traditional medicine, it is used to treat wounds, ulcers, eczema, gout, skin irritations, bruises, burns, canker sores, neuralgia, sciatica, rheumatic pain, hemorrhoids, mastitis and other ailments. 29-30. Externally, chamomile has been used to treat diaper rash, cracked nipples, chickenpox, urinary infections, disorders of the eyes including blocked tear ducts, conjunctivitis, nasal inflammation and poison ivy. 31. 32. Chamomile is widely used to treat inflammations of the skin and mucous membranes, and for various bacterial infections of the skin, oral cavity and gums, and respiratory tract. Chamomile, in the form of an aqueous extract, has been frequently used as a mild sedative to calm nerves and reduce anxiety, to treat hysteria, nightmares, insomnia and other sleep problems. 33. Chamomile has been valued as a digestive relaxant and has been used to treat various gastrointestinal disturbances including flatulence, indigestion, diarrhea, anorexia, motion sickness, nausea, and vomiting. 34. 35. Chamomile has also been used to treat colic, croup, and fevers in children. 36. It has been used as an emmenagogue and a uterine tonic in women. It is also effective in arthritis, back pain, bed sores and stomach cramps. 5. Scientific evaluation of chamomile. 5.1 Anti-inflammatory and antiphlogistic properties. The flowers of chamomile contain 1 to 2% volatile oils including alpha-bisabolol oxides A and B, and matricin, usually converted to chemazoline, and other flavonoids which possess anti-inflammatory and antiphlogistic properties. 12, 1935, 36. A study in human volunteers demonstrated that chamomile flavonoids and essential oils penetrate below the skin surface into the deeper skin layers. 37. This is important for their use as topical antiphlogistic, anti-inflammatory agents. One of chamomile's anti-inflammatory activities involved the inhibition of LPS-induced prostaglandin E2 release and attenuation of cyclooxygenase COX-2 enzyme activity without affecting the constitutive form COX-1. 5.2 Anti-cancer activity. Most evaluations of tumor growth inhibition by chamomile involve studies with apigenin, which is one of the bioactive constituents of chamomile. Studies on preclinical models of skin, prostate, breast and ovarian cancer have shown promising growth inhibitory effects. 39 to 43. In a recently conducted study, chamomile extracts were shown to cause minimal growth inhibitory effects on normal cells but showed significant reductions in cell viability in various human cancer cell lines. Chamomile exposure induced apoptosis in cancer cells but not in normal cells at similar doses. 18. The efficacy of the novel agent TBS 101, a mixture of 7 standardized botanical extracts including chamomile, has been recently tested. The results confirm it to have a good safety profile with significant anti-cancer activities against androgen-refractory human prostate cancer PC3 cells, both in vitro and in vivo situation. 44. 5.3 Common cold. Common cold, acute viral nasopharyngitis, is the most common human disease. It is a mild viral infectious disease of the upper respiratory system. Typically, common cold is not life-threatening, although its complications, such as pneumonia, can lead to death, if not properly treated. Studies indicate that inhaling steam with chamomile extract has been helpful in common cold symptoms. 45. However, further research is needed to confirm these findings. 5.4 Cardiovascular conditions. It has been suggested that regular use of flavonoids consumed in food may reduce the risk of death from coronary heart disease in elderly men. 46. A study assessed the flavonoid intake of 805 men aged 65 to 84 years who were followed up for 5 years. Flavonoid intake, analyzed in tertiles, was significantly inversely associated with mortality from coronary heart disease and showed an inverse relation with incidence of myocardial infarction. In another study, 47, on 12 patients with cardiac disease who underwent cardiac catheterization, hemodynamic measurements obtained prior to and 30 minutes after the oral ingestion of chamomile tea exhibited a small but significant increase in the mean brachial artery pressure. No other significant hemodynamic changes were observed after chamomile consumption. 10 of the 12 patients fell into a deep sleep shortly after drinking the beverage. A large, well-designed randomized controlled trial is needed to assess the potential value of chamomile in improving cardiac health. 5.5 Colic diarrhea conditions. An apple pectin chamomile extract may help shorten the course of diarrhea in children as well as relieve symptoms associated with the condition. 47. 2 clinical trials have evaluated the efficacy of chamomile for the treatment of colic in children. Chamomile tea was combined with other herbs, German chamomile, vervain, licorice, fennel, balm mint, for administration. In a prospective, randomized double-blind, placebo-controlled study, 68 healthy term infants who had colic 2 to 8 weeks old received either herbal tea or placebo, glucose flavoring. Each infant was offered treatment with every bout of colic, up to 150 milliliters, dose, no more than 3 times a day. After 7 days of treatment, parents reported that the tea eliminated the colic in 57% of the infants, whereas placebo was helpful in only 26%, p less than 0.01. No adverse effects with regard to the number of nighttime awakenings were noted in either group, 48. Another study examined the effects of a chamomile extract in apple pectin preparation in 79 children, age 0.5 to 5.5 y, with acute non-complicated diarrhea who received either the chamomile pectin preparation, N equals 39, or a placebo, N equals 40 for 3 days. Diarrhea ended sooner in children treated with chamomile and pectin, 85%, than in the placebo group, 58%, 49. These results provide evidence that chamomile can be used safely to treat infant colic disorders. 5.6 Eczema. Topical applications of chamomile have been shown to be moderately effective in the treatment of atopic eczema. 50. It was found to be about 60% as effective as 0.25% hydrocortisone cream. 51. Roman chamomile of the Manzana type, Chamaemelum, R, may ease discomfort associated with eczema when applied as a cream containing chamomile extract. The Manzana type of chamomile is rich in active ingredients and does not exhibit chamomile-related allergenic potential. In a partially double-blind, randomized study carried out as a half-side comparison, Chamaemelum, R cream was compared with 0.5% hydrocortisone cream and a placebo consisting only of vehicle cream in patients suffering from medium-degree atopic eczema. 52. After 2 weeks of treatment, Chamaemelum, R cream showed a slight superiority over 0.5% hydrocortisone and a marginal difference as compared to placebo. Further research is needed to evaluate the usefulness of topical chamomile in managing eczema. 5.7 Gastrointestinal conditions. Chamomile is used traditionally for numerous gastrointestinal conditions, including digestive disorders, spasm or colic, upset stomach, flatulence, gas, ulcers, and gastrointestinal irritation. 53. Chamomile is especially helpful in dispelling gas, soothing the stomach, and relaxing the muscles that move food through the intestines. The protective effect of a commercial preparation, STW5, Ibergast, containing the extracts of bitter candy tuft, lemon balm leaf, chamomile flower, caraway fruit, peppermint leaf, licorice root, angelica root, milk thistle fruit and greater celandine herb, against the development of gastric ulcers has been previously reported. 54. STW5 extracts produced a dose-dependent anti-ulcerogenic effect associated with a reduced acid output, an increased mucin secretion, an increase in prostaglandin E2 release and a decrease in leukotrienes. The results obtained demonstrated that STW5 not only lowered gastric acidity as effectively as a commercial antacid, but was more effective in inhibiting secondary hyperacidity. 54. 5.8 Hemorrhoids. Studies suggest that chamomile ointment may improve hemorrhoids. Tinctures of chamomile can also be used in a sitz bath format. Tincture of Roman chamomile may reduce inflammation associated with hemorrhoids. 55-56. 5.9 Health promotion. It has been claimed that consumption of chamomile tea boosts the immune system and helps fight infections associated with colds. The health-promoting benefits of chamomile was assessed in a study which involved 14 volunteers who each drank 5 cups of the herbal tea daily for 2 consecutive weeks. Daily urine samples were taken and tested throughout the study, both before and after drinking chamomile tea. Drinking chamomile was associated with a significant increase in urinary levels of hippurate and glycine, which have been associated with increased antibacterial activity. 57. In another study, chamomile relieved hypertensive symptoms and decreased the systolic blood pressure significantly, increasing urinary output 58. Additional studies are needed before a more definitive link between chamomile and its alleged health benefits can be established. 5.10 Inflammatory conditions. Inflammation is associated with many gastrointestinal disorders. Complaints, such as esophageal reflux, diverticular disease, and inflammatory disease 59 to 61. Studies in preclinical models suggest that chamomile inhibits Helicobacter pylori, the bacteria that can contribute to stomach ulcers 60. Chamomile is believed to be helpful in reducing smooth muscle spasms associated with various gastrointestinal inflammatory disorders. Chamomile is often used to treat mild skin irritations, including sunburn, rashes, sores and even eye inflammations 62 to 65, but its value in treating these conditions has not been shown with evidence-based research. 5.11 Mucositis. Mouth ulcers are a common condition with a variety of etiologies 66. Stomatitis is a major dose-limiting toxicity from bolus 5-fluorouracil-based 5-FU chemotherapy regimens. A double-blind, placebo-controlled clinical trial including 164 patients was conducted. 22 patients were entered into the study at the time of their first cycle of 5-FU-based chemotherapy and were randomized to receive a chamomile or placebo mouthwash thrice daily for 14 days. There was no suggestion of any stomatitis difference between patients randomized to either protocol arm. There was also no suggestion of toxicity. Similar results were obtained with another prospective trial on chamomile in this situation. Data obtained from these clinical trials did not support the pre-study hypothesis that chamomile could decrease 5-FU-induced stomatitis. The results remain unclear if chamomile is helpful in this situation. 5.12 Osteoporosis. Osteoporosis is a metabolic bone disease resulting from low bone mass osteopenia due to excessive bone resorption. Sufferers are prone to bone fractures from relatively minor trauma. Agents which include selective estrogen receptor modulators or SERMs, biphosphonates, calcitonin are frequently used to prevent bone loss. To prevent bone loss that occurs with increasing age, chamomile extract was evaluated for its ability to stimulate the differentiation and mineralization of osteoblastic cells. Chamomile extract was shown to stimulate osteoblastic cell differentiation and to exhibit an antiestrogenic effect, suggesting an estrogen receptor-related mechanism. 67. However, further studies are needed before it can be considered for clinical use. 5.13 Sleep aid, sedation. Traditionally, chamomile preparations such as tea and essential oil aromatherapy have been used to treat insomnia and to induce sedation, calming effects. Chamomile is widely regarded as a mild tranquilizer and sleep inducer. Sedative effects may be due to the flavonoid, apigenin that binds to benzodiazepine receptors in the brain. 68. Studies in preclinical models have shown anticonvulsant and CNS depressant effects respectively. Clinical trials are notable for their absence, although 10 cardiac patients are reported to have immediately fallen into a deep sleep lasting for 90 minutes after drinking chamomile tea. 47. Chamomile extracts exhibit benzodiazepine-like hypnotic activity. 69. In another study, inhalation of the vapor of chamomile oil reduced a stress-induced increase in plasma adrenocorticotropic hormone (ACTH) levels. Diazepam, co-administered with the chamomile oil vapor, further reduced ACTH levels, while flumazine-IL, a beta-EZ antagonist, blocked the effect of chamomile oil vapor on ACTH. According to Palladini et al. 70. The separation index ratio between the maximal anxiolytic dose and the minimal sedative dose for diazepam is 3, while for apigenin it is 10. Compounds, other than apigenin, present in extracts of chamomile can also bind beta-EZ and GABA receptors in the brain and might be responsible for some sedative effect. However, many of these compounds are as yet unidentified. 5.14 Anxiety and seizure. Chamomile has been reported in the treatment of generalized anxiety disorder (GAD). But the reports seem contradictory, as an earlier report suggests that German chamomile showed significant inhibition of GAD activity. 71. The recent results from the controlled clinical trial on chamomile extract for GAD suggests that it may have modest anxiolytic activity in patients with mild to moderate GAD. 72. Extracts of chamomile recutita possess suitable effects on seizure induced by picrotoxin. 73. Furthermore, apigenin has been shown to reduce the latency in the onset of picrotoxin-induced convulsions and reduction in locomotor activity, but did not demonstrate any anxiolytic, myorelaxant, or anticonvulsant activities. 16. 5.15 Diabetes. Studies suggest that chamomile ameliorates hyperglycemia and diabetic complications by suppressing blood sugar levels, increasing liver glycogen storage and inhibition of sorbitol in the human erythrocytes. 74. The pharmacological activity of chamomile extract has shown to be independent of insulin secretion. 75. And studies further reveal its protective effect on pancreatic beta cells in diminishing hyperglycemia-related oxidative stress. 76. Additional studies are required to evaluate the usefulness of chamomile in managing diabetes. 5.16 Sore throat, hoarseness. The efficacy of lubrication of the endotracheal tube cuff with chamomile before intubation on post-operative sore throat and hoarseness was determined in a randomized double-blind study. 161 patients whose American Society of Anesthesiologists (ASA) physical status was IR2, and undergoing elective surgical, orthopedic, gynecological or urological surgeries were divided in two groups. The study group received 10 puffs of chamomile extract Chamaemelum M spray, total 370 mg of chamomile extract, at the side of the cuff of the endotracheal tube for lubrication, while the control group did not receive any lubrication before intubations. Standard general anesthesia with tracheal intubations was given in both groups. 41 out of 81 patients, 50.6%, in the chamomile group reported no post-operative sore throat in the post-anesthesia care unit, compared with 45 out of 80 patients, 56.3%, in the control group. Post-operative sore throat and hoarseness both in the post-anesthesia care unit and at 24 hours post-operation were not statistically different. Lubrication of endotracheal tube cuff with chamomile extract spray before intubations cannot prevent post-operative sore throat and hoarseness. 77. Similar results were obtained in another double-blind study. 78. 5.17 Vaginitis. Vaginal inflammation is common in women of all ages. Vaginitis is associated with itching, vaginal discharge, or pain with urination. Atrophic vaginitis most commonly occurs in menopausal and postmenopausal women, and its occurrence is often associated with reduced levels of estrogen. Chamomile douche may improve symptoms of vaginitis with few side effects. 79. There is insufficient research data to allow conclusions concerning possible potential benefits of chamomile for this condition. 5.18 Wound healing. The efficacy of topical use of chamomile to enhance wound healing was evaluated in a double-blind trial on 14 patients who underwent dermabrasion of tattoos. The effects on drying and epithelialization were observed, and chamomile was judged to be statistically efficacious in producing wound drying and in speeding epithelialization. 80. Antimicrobial activity of the extract against various microorganisms was also assessed. The test group, on day 15, exhibited a greater reduction in the wound area when compared with the controls, 61% versus 48%. Faster epithelialization and a significantly higher wound breaking strength. In addition, wet and dry granulation tissue weight and hydroxyproline content were significantly higher. The increased rate of wound contraction, together with the increased wound breaking strength, hydroxyproline content and histological observations, support the use of recutita in wound management. 81. Recent studies suggest that chamomile caused complete wound healing faster than corticosteroids. 82. However, further studies are needed before it can be considered for clinical use. 5.19 Quality of life in cancer patients. Essential oils obtained from Roman chamomile are the basic ingredients of aromatherapy. Clinical trials of aromatherapy in cancer patients have shown no statistically significant differences between treated and untreated patients. 83. Another pilot study investigated the effects of aromatherapy massage on the anxiety and self-esteem experience in Korean elderly women. A quasi-experimental control group pre-test post-test design used 36 elderly females, 16 in the experimental group and 20 in the control group. Aromatherapy massage using lavender, chamomile, rosemary, and lemon was given to the experimental group only. Each massage session lasted 20 minutes and was performed 3 times per week for 2 3-week periods with an intervening 1-week break. The intervention produced significant differences in the anxiety and self-esteem. These results suggest that aromatherapy massage exerts positive effects on anxiety and self-esteem. 84-86. However, more objective clinical measures should be applied in a future study with a randomized placebo-controlled design.
Okay, so we are looking at chamomile is a herb that we can actually grow in our garden. And you've seen all the miraculous stuff that it supposedly can do. And this is from the National Institute of Health, which is NIH. This is a government agency funded by the government, and it's an authoritative news research facility. Okay? So just take that to mind. But I'll put all 4 links in there for all the stuff I talked about tonight. And I want you to understand that, consult with your physician. I'm not a doctor, but the reason why I'm growing chamomile is because it is a medicine in many respects, used for thousands of years. And you should consider it yourself. I hope each and every one of you have a great night. God bless you all. I love you all. And make sure you subscribe, ring the bell for notifications, and make a comment down in the description area. And everything will be down in the description area for you to click on. Okay? So, good night. And chamomile is one of the most awesome things you can actually work with. And that's why it took so long for this video, because it's really a great herb, a flower, chamomile. Get with it. Love you all.